The Chaz Health Association of Zambia, Chaz, has partnered with its affiliate Chaz Health institutions to promote financial health of rural communities through savings in Mpongwe district in the Copper Belt. Chaz has been promoting village savings and loan associations (VSLAs) through its affiliate Chaz Health institutions in Mpongwe District, Copperbelt Province, and in Petauke District in Eastern Province, with support from the Rural Finance Expansion Program (Rufep). Since 2016, Chaz has been working with Rufep to build capacity of VSLAs in Petauke District in Eastern Province, with support from Rufep under the Community-Based Financial Institutions Linkages window.
For the groups that have been linked, for us the feedback, particularly because we have to hear from the beneficiaries how this is working. When I talked to some of those women, they were saying, we wish this had happened a long time ago. We would have been somewhere by now. And I think the training, they are finding that they are doing things better. They're understanding. They're understanding the whole issue of savings. Because when we started, it was just you must save so that, for the rainy day. They feel empowered, they're more confident, they can go into the bank, they can transact, they can pay for whatever services that they want from their own money. So it would be nice for us to scale up. I would encourage this partnership. For us as Chaz, I think we have benefited from the project. We also have been empowered at the central level, but we also want to scale this project up so that more women in Zambia can benefit. More women in Zambia can improve their health status and their food security at household level. So I would want to look at Mpongwe and St. Teresa as our pilot project, which has worked very well. And we have learned lessons. We know now that what works and what doesn't work. And even things that haven't worked very well, they provide good lessons. So how do we do it better? So let's consider those two as our pilot project, and we have lessons that have learned. We have good lessons that we can go and extrapolate somewhere else. We can scale up and go beyond Mpongwe and St. Teresa.
So we've had a long relationship with Chaz. I think we're one of the first ones that supported them to actually start what is called the Village Savings and Loan Associations. Chaz came to us again and said, no, we want to improve this even better. Why don't we engage with commercial banks so that this money goes directly to the bank so that it's safe and then people can access the money when they want. So we engage with agents that are nearby so that once the group has finished the meeting, they can just walk and deposit that money and all the other things that we do.
In Mpongwe District, Chaz is working with St. Teresa and Mpongwe Mission Hospitals of the Catholic Church and the Baptist Church to promote financial health of rural communities through village savings and loan associations. This has uplifted the livelihoods of the rural people who are mostly vulnerable and lack access to basic health care and financial services. With support from Rufep under the agency and mobile banking window of the Innovation and Outreach Facility, Chaz is implementing a project dubbed Community-Based Microfinance Mobile Banking Project through St. Teresa Mission Hospital in Mpongwe Rural. Apart from facilitating linkages with formal financial institutions, The community-based microfinance mobile banking project promotes digitization of transactions by VSLAs using mobile banking. On the 21st of September 2021, a Rufep delegation went on a monitoring field visit to assess progress by Chaz on the project. The first point of call was St. Teresa Mission Hospital in Mpongwe District. Sister Veronica Bwalia is a Deputy Administrator for St. Teresa Mission Hospital. Sister Veronica briefed the Rufep team on progress made by her health institution on the Chaz and Rufep-supported project in Mpongwe District. She said field officers and agents were trained to coach the savings group members on business management and income-generating activities, adding that a number of them opened bank accounts thereafter.
Members of saving groups, including those living with HIV and AIDS who have never saved or run an IGA, are now able to save and borrow from their village bank to invest in income-generating activities. Field officers and agents who were trained are able and willing to share knowledge, ideas, and skills with others, and this has resulted in opening of bank accounts in planned target groups in a very short period of time. As opposed to tradition, IGA's beneficiaries are more self-reliant and responsible, productive, and are able to provide support to their families and themselves with nutritious food, transport money to and from the hospital for medical checkup.
She thanked Rufep for the initiative to digitize savings groups and linking them to Zanaco, which has contributed in bringing financial services closer to the people through Zanaco Express agents recruited under the project. Project Microfinance and Mobile Banking Supervisor Mebin Silavwe said savings groups have empowered vulnerable people who were under the care of health institutions to have their own stable incomes and to be self-reliant. Mr. Silavwe disclosed that Zanaco Express agents were recruited from within savings group members and are providing financial services within the community.
The idea, it came directly to assist the people living with HIV. That was the initial of the village banks in the community. With the coming of Rufep, I think we have moved a step forward. Chaz, I think through the funders to provide trainings together with Zanaco, where for this institution, I've been a field supervisor, and three agents and a field officer from the community have been trained together with 37 groups. Initially, we've got about 50 saving groups, but we have managed to train about 37 groups who are ready to take up this system where we should be using mobile banking.
We are happy and glad that almost each time we come to St. Teresa to come and just maybe facilitate one or two programs, Zanaco is always there with us. If it is for 5 days in the field, they will be there 5 days in the field. Yeah, so in terms of opening accounts, I think that's why we were able to open a big good number of accounts, because Zanaco itself would come and do the actual opening of the accounts instead of the members of the saving groups getting the forms and traveling with them to Wansha, which is a bit costly.
Thankful for being a part of this innovative project, which has really helped us from bank and bank, and it has really helped us to reach a point where we can go as far as 100 meters and someone feels good about the service that they are getting in terms of mobile banking, which is also helping and to reduce on the risk of their finances, as it used to be where they used to keep money in the boxes. So we are so much pleased, and we endeavor to continue supporting so that we can actually make successful story of this project.
From St. Teresa Mission Hospital, the Rufep delegation proceeded to meet Kuchitekela Village Banking Group to witness how the groups have digitized their transactions using mobile phones.
Okay. Okay. Shinga.
1,000.
Okay. Okay. Mwalabu mpya account number and phone number.
Account number.
Account number. Okay. 70864. Okay. Check number.
Wilamba ekwesu nakukuli. Wilamba ekwesu nakukuli. Wilamba ekwesu nakukuli. Wilamba ekwesu nakukuli. Vale.
Iringi twale ekitatimbi nga mwakumana ifine twikere mwaikala pamopene limbi umunobe tawishibe limbi mulwere ashitashani kusanga ati bonse kuti mwashitashani yareba ko risk at least this time nga mwabomfya amafoni nanguli kunganda ulebo okutuma impia sha washitashani wa savinga then mukuikate impia tatushira pita muminwe ishingi limbi uyu aikatako sometimes imbita kwaleba limbi na hand sanitizer tamukwete nangu kusamba kumino tamule shitashani tamule samba corona yali izi yako bati yapitira ku muntu umbi nomba inonchita ifitwambo kubomfya amafoni takuli nonidya kwe bati impia uyu aikata so ishi chintu twachipokelera sana chintu ichisuma sana cha kusaving na pamafoni
saving ya mafoni newe naitote cha kuti ya wama pantu ifi naitotera ni pifi so nangu ndi kumabala kuti ndalama naituma ku group indi mo saving kuti yafika teti ndofa kati ati teti mbone kati barofa pantu utabalipo nangu chilipo kuchira muri phone kuti naitumia ndalama yafika ku saving
notwatariga ndali wona muri kuti chisobano boyo chakuti waleta ka 50 kwacha wajoga mbono obo unoja kasika kumama ina mwaga mu December notwakara kwa abana mari ija kusanga ndawo weza 10,000 aya mari aya akakundu ya ngombe kunganda una mwana daga kuyuhiga ina ngukuchetekera soka bunga kamuho bwaga nkabo tumaningi no mutu gwahiri ya muri bachazi group iguti musumanane iguyinda mu bantu mumubikide ababo sensemo na mugati mu minzi.
Michael Mwitela is a Zanaco Express agent recruited by the project to ensure that savings group members deposit the money into their mobile money accounts before transferring it into a group account.
For Zanaco Express agency hapa ngabaisa tulapere ndalama no kupoka kaye tulapoka tulasungila so ndetasha hapa karamba sana kuri ba Mr. Joyasi pari programu kaina ba Rufep na isa koseleshiwa sana pakuisa mkumfu ati twalambo saving na pamafoni kwena ukurande chinga fyale moneke fyakosa ro bayishirera ndokwe badawe twalambo saving na pamafoni twalambo saving na pamafoni abantu ababali apa bambe bale fya saving na pamafoni imotuka fikoni shefe tafyakosa tafyashupa pakafe bayisa mukutusambirisha after batusambirisha nomba twapokerera no kupokerera twaumfu.
The Rufep team also visited the Baptist Church Mpongwe Mission Hospital, another health institution and member of Chaz involved in the promotion of village banking in the district. Hospital Administrator Rose Munkombwe thanked Chaz, Zanako and Rufep for promoting savings group linkages with banks and digital savings through mobile banking.
The village banking program actually has really improved the socio-economic status of our community members. We appreciate Chaz for this innovation, and now we also appreciate the Rufep because with the coming of online saving, I think it would help us. It gives financial security somehow to the members.
Rufep Program Coordinator Mike Ombulo said Rufep aims to increase access to and use of sustainable financial services by rural people. Mr. Mbulo added that sustainability entails that innovation supported by Rufep through partners such as Chaz and its affiliate members should continue beyond the support from the program and its life cycle.
Rufep as a program, as you might know, it's a rural finance expansion program. It's under the Ministry of Finance, and our mandate is to support various institutions to be able to take financial services to rural areas. And we are also mandated to see that we pay particular attention to those groups that ordinarily they would not get the financial services, the women, the youth, other groups that are vulnerable. And so our relationship with Chaz, I think, points to that. You are able to support caregivers that are looking after communities, community members that are suffering from these long illnesses, to be able to raise some income to support the medical issues and improve on nutrition. So although Rufep supports many other savings groups around Zambia, this category of savings groups that are linked to health care provider, health care institution through Chaz are sort of unique.
The team proceeded to meet saving groups that were attending a business and financial training in preparation for migration from cash-based transactions to digital savings in the next cycle.
Ukusevinga pamafoni twasanga kwebati nachiba ichayana munshira ya kwebati akale kwaleba ukusevinga impia ad cash kulia kwaleba twalesanga ati impia shale ruba yambi takwaleba okuchita capture but ukusevinga through amaphones chalabapo ichabako easy kuli ifwe kozi ikalaba fe direct palya twatuma mu account ba secretary bachitashani batulembelako bachita document
kusevinga kwa pamafoni ififine mwa twambo okusambirira financial literacy pantu fwego tukamba okusevinga pamafoni ni share tukaisura seko mu November pa 3 after share out same day etuyingira na ma saving so apata tatunga yambo okubomfya kusevinga na phone mulandu tulirekere kusevinga tulegwe shafye nkongole so tulesambirira 50 ngabo mfya phone mu next seko itukabane kuba ne kuingiramo
tuletotera bachazi pakutusambirisha ngefo balera ndaba nandukwe bati ichichira chisuma pantu nomba indalama tuleshisungira ku banki akalene shakwete pono na mano yakwe bati kuti naisula account apana adikwata na account yandi mu phone yumu iya kuzanako.
Rufep was happy to witness commitment by savings group members to better their livelihoods through savings and their willingness to adopt mobile banking as a safe and convenient way of promoting cashless transactions in the wake of COVID-19.
Tuli abasansa sana ukumfwa efya mulebomba nokumfwa efya emyeo shenu shirebe shakuchinja. So ifikwene efefe bade emifundo okutampira kuli ba Chaz kuli bazanako ni knowledge ni empowerment bade emipela imwe ukweba ati mwishi befya kubomba mwishi befya kusunga mayanda bantu ukufumina apa abana besa bali mu mayanda yesu tali bala sambirira bala ya kumasukulu nishi future yesu na ifwe mu mayanda nga yaba bwino ne chalo nishi chawama.
Wilamba ekwesu nakukulimu Wilamba ekwesu nakukulimu Wilamba ekwesu nakukulimu Wilamba ekwesu nakukulimu Balesa nifu Banduweni nifu Bamatia nifu Batigola nifu